Today's official figure coming from the CCSA this morning to the media is 9,276 new cases and 72 deaths exacerbated by COVID. Regarding today's meeting of the government to review recommendations for extreme controls in and around the nation, we go to the CCSA press meeting.
First of all, I'd just like to mention that prior to this briefing, there had been a lot of news reports released into the public. In actuality, it had inaccurate information to some degree. There are a lot of details in the new measures, which I'll go through, but the reports that you have seen was not actually the official one. Perhaps it was a leak of. The inoculation drive now has covered 38.9% of those residing in Bangkok, and this is actually those who have received at least one dose. Bangkok still tops the area with the highest number of cases. The numbers of infections are on upward trends, and we could possibly see the daily number of new cases exceed 10,000 per day very soon. And the number of deaths could exceed 100 daily by the next 2 weeks. So therefore, with this situation at hand, the Prime Minister and the CCSA has decided to come up with impose new measures that are necessary to prevent further loss and save our healthcare system. The dark red provinces, or maximum and strict controlled area, remain the same 10 provinces, which are Bangkok, Nakhon Pathom, Narathiwat, Nonthaburi, Pathum Thani, Pattani, Yala, Samut Prakan, Samut Sakhon, and Songkhla. In terms of the new restrictions, I'll start first with the restrictions that are for the 6 provinces that are in the dark red zone. From the 12th of July, Monday, we'll have the closure of shopping centers with the exceptions of supermarkets, takeout restaurants, banks, and financial institutions. Standalone restaurants, markets, convenience stores will be closed at 8 p.m. and may resume service at 4 a.m. Public transportation service will be seized at 9 p.m. and will resume service at 4 a.m. Spas, beauty centers, and massage parlors will also be closed, while public parks will be closed at 8 p.m. I have to emphasize this because the information that was released prior to this briefing had different inaccurate times. In addition, all government departments are requested to work from home at the maximum capacity. And the CCSA would like to ask the private sector, businesses as well, to similarly apply this work from home scheme at the maximum capacity as well. I'll move to the dark red zone, which includes all 10 provinces, meaning Bangkok and the surrounding provinces, as well as the 4 southernmost provinces mentioned. So this is for all 10 provinces. What I'll say now is for all 10 provinces in the dark red zone. Firstly, of course, avoid making unnecessary travel trips. The public is also asked to stay at home from 9 p.m. until 4 a.m. in the morning. And leave your residence only for important reasons, for essential purposes. Also, the prohibition of gathering of not more than 5 people, with the exception of certain cultural events such as funerals. I'd like to move on to interprovincial travel. Transportation companies will be asked to reduce their service, and relevant authorities will impose stricter restrictions on interprovincial travel, especially from 10 provinces in the dark red zone, including quarantine measures at the destination to minimize the movement of people. If you're traveling from the dark red zone to other provinces, checkpoints will be something that you'll be meeting. So checkpoints set up by police and other personnel starting tomorrow, Saturday, the 10th of July. Our maximum control area has increased from 5 to 24 provinces. And the controlled area, or orange zone, increases from 9 to 25 provinces. I'd like to move on to the vaccination issue that was mentioned by Dr. Apisamai as well. So at the moment, the government's priority is the inoculation of adults aged, senior citizens aged 60 and over, and people living with 7 underlying conditions. The CCSA has approved the plan to distribute 80% of vaccine supply in July to allocate to people in Bangkok, with priority of adults aged 60 and over and people living with the 7 underlying conditions. Now, regarding vaccines that Thailand received from our friends from abroad, the Ministry of Public Health proposed the distribution plan for this part as follows. Vaccines from the US would be allocated to, number 1, medical personnel and health workers directly related to COVID work as a booster dose. Number 2, adults aged 60 and people living with 7 underlying conditions. Number 3, foreign nationals in Thailand, elderly people with conditions as the priority in the foreign nationals group. And number 4, those who need to get the vaccines before going abroad, such as students, athletes, and diplomatic personnel. The vaccines received from Japan, which is 1.05 million doses of AstraZeneca, similar in terms of the grouping for the vaccines that have been provided by the United States. In terms of testing, the CCSA has discussed about the usage of the rapid antigen test, as the regulation is required to be amended before the public can use the antigen test kit. Health Ministry will further discuss with relevant agencies before issuing a guideline for the public, expecting to be finalized by Monday.
Local and national news today from Fabulous 103 FM and Fabulous Pattaya Media Group. And to get a notification every time we release another bulletin or program, like and subscribe to our channel, Fabulous Pattaya Media Group, by using the link below.